It's Dr. Jason Hochfelder from Hudson Valley Bone and Joint Surgeons. Today we're going to talk about having orthopedic surgery in the time of COVID. I get a lot of questions from patients asking about the safety of coming to the hospital and having surgery with the pandemic. And the first thing I'm just going to point out is just a simple fact, which is that since the pandemic started almost a year ago, we've performed several hundred elective orthopedic operations, hip and knee replacements, and we've not had one patient come to the hospital and contract the virus from being at the hospital or from their surgery. Second off, every patient who is going to have surgery with us 2 days before the operation is tested, and this is not just with our practice. This is actually one of the hospital policies to make sure that no one is exposed. Second thing is that even when there are patients at the hospital who do have COVID, they're kept in a completely separate wing of the hospital. They're not having interaction with the same staff, the same physical therapists, the same nurses, even the same people that deliver their food. These are all kept separate just to make sure that no one has any unnecessary or undue exposure. And most importantly, one of the things that this pandemic has brought around is some change, which is that we've been trying to get patients out of the hospital sooner, and we've realized that there's really no downside to that. So whereas in the past we used to keep patients with hip and knee replacements in the hospital for a few days, now we've been keeping them mostly one day, and even in some cases we've been sending people home the same day. So in reality, I think that it's just as safe as it ever was. And in fact, there's some things that have come around that have made having hip and knee replacements even now even safer than they were this time last year.